So, if you guys missed that, I told you previously, we are going to be talking about diabetes with some health experts as well as people who have lived through the experiences of diabetes. If you don't know, diabetes is a condition where the body doesn't produce enough insulin or cannot use it properly, causing high blood sugars. Insulin helps your body use glucose, aka sugar, for energy. Without it, the level of glucose in your blood becomes too high. Now, I'm going to introduce some of our health experts first. So, if you would please like to introduce yourselves, let the people know who you are and what you do, and yeah, what is your part in, diabetes and how you are helping this.
Hello, my name is Dr. Mahima Gatani, and I am a GP working in Brent for the last 18 years. I'm also a clinical champion for Diabetes UK, which, as many people will know, is a biggest diabetes charity in England. And so I specialize in diabetes care, and I feel very passionate about caring for patients who have diabetes.
Thank you so much.
Hello, my name is Anjali Sicharan, and I'm a diabetes specialist nurse working at Central London Community Healthcare Trust, known as CLCH. We work across Brent and Harrow and discuss with patients in face to face or virtually. We provide education, and which we will be discussing later on.
Thank you so much. And if the two lovely ladies would like to introduce themselves as well, these are our patients.
Good afternoon, good evening rather. I'm not a patient. I'm one of the health educators. My name is Diana Collymore, health educator for the Wisdom, Dollar and Easton team. I work under the HEPS program, which is a health educator education program that teaches people how to manage their diabetes, etc. I also set up groups, face-to-face groups. So I think we can talk about that at a later stage.
My apologies. Thank you.
Hello, I'm Pravina Vandra. I've been a diabetic for almost 20 years, but I must have been a walking, talking diabetic for 5 years prior to that. So anyway, I'm here as someone who's really managing very well with the help of Diana Collymore, our supporter, and I'm really, really pleased I found her. Thank you.
That's lovely. Thank you so much. And obviously, we spoke about it briefly, but if one of our health experts would like to go into a bit more detail about diabetes and about what it does to our body.
Yes, that's fine.
Okay, so I can start with that because, as I said, I really feel passionate about caring for patients who have diabetes. Now, diabetes for most people is a very, very silent condition. So you may not actually feel it or know about it until you are aware. And for most people, it's only with health screening that we find that they have diabetes, especially in the early stages. And it's better that you catch it in the early stages, but because in the later stages, it can be quite severe. So, as our lovely host mentioned, diabetes happens when you do not have enough insulin or if the insulin is not working properly in your body. So, broadly, diabetes is divided in two types. The first type, which is called type 1 diabetes, is sadly a more severe type of diabetes. It happens in much younger people, sometimes even the children, and it is more like a genetic condition where their body does not, so there is an organ in the body called pancreas, which produces insulin, which is needed to metabolize or use the sugar which we have, so or eat. So this organ, if it doesn't function properly, then it doesn't produce this insulin hormone, And then you can have type 1 diabetes, which is a more severe, happens in much younger people, and it can present as they feeling very unwell and losing weight rapidly, feeling very thirsty, passing a lot of urine, and many other symptoms. So if any children feel any of those symptoms, they should see their healthcare professionals urgently. But the most people have type 2 diabetes, in which their body does produce insulin, but it doesn't work properly. Now, this can happen because of multiple reasons. Um, Number one is, if we are overweight and, body needs a lot of insulin and it's not enough, then this can happen. Or if we do not exercise enough, or sometimes if we eat too many calories, that's another reason why this can happen. So broadly, two types of diabetes. I will also ask my colleague Anjani to add if I've missed anything there.
All I would add is also gestational diabetes. So some women get during pregnancy, usually while they're pregnant, can have diabetes, which goes away when the baby is born. But their risk for diabetes is higher later in life. So that's the only part. So it's really making sure people who are planning pregnancy, young people with diabetes, is aware of diabetes and having good control of their blood glucose level. So preparation. So thank you, Dr. Thadani.
Thank you so much. I didn't actually even know that you could get diabetes whilst you're pregnant, which I think is really interesting. Is that because of any reason, or is it just like a hormone imbalance? Like, what actually causes that diabetes run within the pregnancy?
So, yes, that's a very good question. And it's very, very important to understand that. Sometimes, especially if their diabetes is running in the family, genetically you are more predisposed to this condition. And again, the lifestyle factors we mentioned earlier. So if a woman in childbearing age is overweight or not doing enough activities, those are the other reasons they can have diabetes, which is called gestational diabetes. Also, like you mentioned, the hormones during pregnancy does predispose people to having, running high blood sugars. So that is why it is very important to kind of look after yourself before you're planning to become pregnant. And that also includes taking folic acid, which is very important for the brain growth of the baby, amongst other vitamins, which are vitamin D and other things. But yeah, taking folic acid is very, very important for women. And if they already have diabetes, then making sure that they've had all their checks and their diabetes is well under control, including an eye test, which we will cover later as well.
Amazing. And was there any, or is there any symptoms if somebody is unaware, if they are going through obviously diabetes whilst pregnant? Is there anything or any warning signs that, women should look out for when this is happening?
Yes, like we said, feeling extremely tired, which is out of proportion. Urine symptoms like getting frequent urine infections, passing a lot of urine, and wounds not healing properly. So that just means that they might be, running high sugar.
Thank you so much. And I wanted to ask, who is most at risk and who is basically most at risk of diabetes? I know you said previously, obviously, if people are, overweight and people who aren't maintaining a healthier lifestyle, is there anyone else who is also high at risk that doesn't come under that category?
answer this?
Yes, it is. Sorry, and I'll let Anthony come in here.
So people, as Dr. Gitani said, people with a family history and also of ethnic origin. So, for example, people of African origin, Caribbean origins, and South Asian, they tend to have higher risk. And as Dr. Gitani was saying, if you're overweight, obese, physically inactive, and people over 40 years of age, or could be younger. We're seeing more people younger being diagnosed with type 2 diabetes. And as we suggested earlier on, with gestational diabetes during pregnancy. Over to Dr. Gitani.
Thank you, Anjani. I would just want to highlight one important point here, because when we say overweight, we need to know what exactly we are talking about. So overweight in people from different ethnicity could be different. So for Caucasian, overweight would be anybody with a BMI of more than 25. Whereas for people from ethnic origin, South Asian, and African and Caribbean origin ethnicity, for them the normal BMI is less than 23. So anybody over from those ethnicity with a BMI more than 23 would put them at higher risk of developing diabetes.
Amazing. And it's very biology focused, isn't it, right? A lot of it is all kind of genetics. And I know we spoke about it as well previously, but how is there a prevention that people can be, looking after themselves or can be focusing on to prevent some of these early signs of diabetes?
Absolutely. Like we said, staying active, okay, and the WHO recommendations for activity is 150 minutes of moderate to intense exercise accumulated over the course of a week. You could do like 5 days a week, half an hour to 40 minutes, or every day, but it is very important to stay active. And also to maintain body weight, like we said, and to avoid too much of sugar. Well, it's very difficult nowadays because sugar is all around us. You walk anywhere and there is sugar. So just be aware of what you're eating. So avoiding sugary food and drinks, as well as ultra-processed food, is very, very important. Some people think that fruit juices are healthy, but they are full of sugar. And also there are certain things like fizzy drinks. We don't realize, we just drink it for energy, but it can be very, very harmful. So yeah, staying away from all those things and keeping yourself hydrated with water, really, which is the best. Yes, if I've missed anything, then I'll ask Anthony to come in there, please.
Everything. All I will say is that having your regular checkups with your GP, if you have any of the symptoms that was discussed, it's really important. And yes, choosing healthy foods, it's really important. Yeah. And staying active. We can't emphasize more about activity, and what you eat is really key to, especially with type 2 diabetes, even before we go to medication. And also looking after your blood pressure, your cholesterol, avoiding, stop smoking, all the advice that we normally give in general practice. So that is how you staying healthy.
Thank you so much. And I know there was a small mention earlier that you have seen an influx in a lot of younger people getting diabetes. Do you think that's due to the food processing now that we have, or do you think it's just like lack of motivation or not much accessibility for fitness wise? Why do you think there has been an influx?
I think, yes, there are multiple factors, and most of them are environmental. Some of them may also be genetic, because more and more people are getting diabetes. If both their parents have diabetes, they're at very high risk. And yes, it is quite a lot of, the choices we make with our food and lack of activity. I must say that we are spending a lot of time in front of screen rather than going out and exploring. So there is a lot to be done in our lifestyle, which kind of is very essential for better health.
So also add, at GP practices, they are checking more blood tests regular. So because people are having regular monitoring for their blood glucose level, you will find people are being picked up earlier. So they do not end up having the signs and symptoms we talk about that normally one would experience.
Amazing. Thank you so much. And I just wanted to reiterate as well and asking the questions of what are the early warning signs of diabetes?
Anjani, would you like to come in there?
So the early warning signs, as Dr. Gidani was saying, sometimes you feel really thirsty, but you have been drinking lots of water. The thirst sensation is still there. Oh, you're going to pass more urine, especially at night time. You're getting up and passing more urine. Feeling tired and weak because the sugar is not being used up in the muscles, and blurred vision. So one of the symptoms could be blurred vision. Some people are picked up when they go to the optician, but once your blood sugar is controlled, the blurriness goes away. That's the initial phase of diagnosis, yeah? And again, what was highlighted is slow healing wounds, having frequent infections, yeah? For people mostly with type 1 is unexplained weight loss without trying, yeah? So those are the common symptoms for people who really needs to make an appointment and see their GP early to say, I've got some of these symptoms, because we are picking up people earlier who don't have symptoms. Over to you, Dr. Gitani.
Yes, but like I said, that most of the time, diabetes is a silent condition. So please do not wait till it becomes very severe, in which case you can have lots of symptoms. Even if you have slightest doubt, come and get checked, please.
Thank you so much. And I know that sometimes I'm guilty of this as well, is sort of, leaving things to see if something gets worse or if you start feeling worse, sometimes you don't always want to, go to a GP or because you never feel like symptoms are bad enough. But I think obviously everything that you're saying it can be quite misunderstood a lot of the time, especially if you're feeling tired. People can put that down to, vitamin D, or if you're drinking a lot, obviously urinating a lot as well. But like you guys have said, so many of these signs are actually big red flags that really should be picked up on. So I really just want to reiterate to the audience listening, if you are suffering with any of these symptoms, please just get checked out. Rather be better safe than sorry, because like you said, obviously these things can get worse and you don't want it to get to the point where, obviously we're dealing with something a lot bigger than is manageable at the start. And I wanted to speak about how is a patient diagnosed and what is the next steps when that diagnosis has been taken.
Okay. So we normally diagnose diabetes with a blood test called HbA1c. It's a very important. Previously, we used to use other methods like checking sugar, but that's not really accurate anymore. And some people might still think that checking a finger prick sugar is enough, but not really. The diagnosis of diabetes can be made only and only with this blood test called HbA1c in most cases. Now, this is a very unique test, is that it tells about how your sugar has been for the last 4 months. So it's not like immediate sugar. So if you say, okay, I had sugar yesterday, then, my HbA1c will be high. That's not true. So it gives a true reflection of diabetes, how your sugars have been for last, 4 to 6 months. So if you've had this blood test and it's normal, then you're highly unlikely to have diabetes. So, and for people who do have diabetes, it is very important to understand this number because most of the time people who have diabetes need to be empowered to control their condition. The healthcare professionals are there to help them out when needed. But if they know this number, how it has been, then they will know how their diabetes has been. So this number I can go through very slowly with people so that they understand. So HbA1c number, if it is less than 42, then that's normal. However, if it is between 42 and 47, then you are at a risk of developing diabetes. And it is very important time for you to start working on your lifestyle, your diet, exercise, your body weight, all of those things, and have yearly checks to make sure that it doesn't go over 47. Once it goes over 47, then you do have diabetes. And in that case, you may need to start taking tablets. And also, you will need to have other checks, which we will cover in a bit. But before that, I will ask Anjali to add if I've missed anything there.
Of diabetes, HbA1c over 48, but we normally advise people within the first 6 years of having a raised HbA1c and diagnosis, you have the opportunity to reverse your diabetes, go into remission, and stay within that lower range, as Dr. Kitani was saying.
Thank you so much. And once someone is diagnosed, what is the usual pathway? Like, what does that pathway look like? Is there, the medication, and what is those lifestyle changes that are then made after?
So yes, what we normally do is once we know that a person has diabetes, we invite them for an education program called Desmond, which is excellent program. And I will invite Diana to actually, tell more about it. But everybody who gets a diagnosis of diabetes should go on this program because, like I said, it is most of the time a lifelong condition. And if you control it, then you can avoid getting complications later. Dinah, would you like to tell us more about the education about diabetes?
Yes, of course. As a health educator, I set up a 6 weeks program under the HELPS program with other health educators. And within the 6 weeks, we have different activities for those who's either been diagnosed with diabetes as a type 1, type 2, or pre-diabetic. And the other word for pre-diabetic is borderline, because most people knows it as borderline. So when they come to us, we get them to sit as in a face-to-face group. We get them to discuss different activities. We also teach them how to talk to their healthcare providers, because some people are very shy when they go to meet their GP. They don't have the relevant questions. They know what to ask, but when they come out of the GP office, they're then saying, oh my God, why didn't I ask them this? Why didn't I ask them that? So what Dr. Jatani has just said makes so much sense for the peers listening outside there today, because it's about actually teaching them how to manage their diabetes, how to talk to the healthcare provider, who's the GP or the nurse. And also we talk about emotions, because it's very, very imperative that if someone has diabetes, they must talk about their health and well-being, especially when it comes to emotions. And this is where family members are invited to come along to the diabetes peer support groups. And by so doing, we've had quite a lot of people who's gone into remission, because sometimes, they weren't taking their medication, especially metformin, which is imperative. And by so doing, by listening to other peers and exchanging different stories and actually coming every week, it has built up their courage, not just to do more exercise, but to be more active in the community as well. And yeah, I find that by being a health educator, setting up these groups, you know, the 6 weeks program is not enough because they want to learn more. What we do, we refer them to Brent Health Matters Advice Helpline that has all the clinicians on that line, anyone that you speak to on option 4, because we give out a leaflet, and I'll give you the telephone number at a later stage. They're able to talk to the practitioners, the clinicians, there's the dietitian, there's a pharmacist, because I noticed that when we invite the clinicians, especially the pharmacists, to the peer support group, these people are they're so excited. The pharmacist as well should be given a platform to say how he or she is met by the peers, especially in diabetes, because diabetes is very complex. And one thing I have to say, I think we missed out the Irish community and other ethnic communities, because we have a lot of leaflets that's actually printed in different languages. And we have quite a lot of people who has diabetes in the Romanian community as well. Not just that, but you know, instead of saying just African Caribbean and South Asian, it is not, it goes to other ethnic minorities as well. And especially in the Somalian community, we are now trying to get people to come more cohesive into understanding that the diabetes peer support groups are there for them. It's a face-to-face platform where they can exchange recipes, all different sorts of things, you know, and I find that Doctor, can I say that most of the residents who come, who's been diagnosed with diabetes, don't like drinking water. So that is one of our main stance, that every time they come to a peer group, they must drink water. So what I do, I provide the water, because, you know, sometimes it's good to dangle the carrot. So by so doing, I know that Pravina is going to enhance upon that, because we need to get people more active. And I tell you, it's been very, very rewarding. I'm very, very happy to be here today to say to the listeners of this, the Beat FM, please do try and make contact with us. Brent Health Matters Advice Lines, we have some very good committed people who specifically train in diabetes. In terms of the Daphne program, that is done by the GPs, yes, the Daphne program and the Desmond program. But Brent Health Matters, which only just came in place from 2020 because of the amount of fatalities that we had in the community, has been set up specifically to help anyone who has diabetes or who are pre-diabetic. And it's not, the groups are not judgmental. We talk about everything, cost of living, everything is involved there. People talk about how they eat. You know, this is what it's all about, because we need to manage our eating habits. We need to have a better lifestyle. And as I said, you know, at a later stage, I can give the telephone numbers, because we do referral systems as well, not just to Brent Health Matters, but to places like Rewind. And we work alongside the mental health team as well, because as I said, when I first started to talk here about emotions, it's very, very imperative that anyone who has diabetes must be able to talk about their well-being, because Brent Health Matters is not just for diabetes, but it's a social care platform to get people enhanced in how they manage their diabetes and to live longer, because this is what it's all about, living longer, seeing your grandchildren, seeing your great-grandchildren. And that's what I usually say to them.
Thank you so much. And it seems like, Diana, you're doing an incredible job. And these communities is exactly what people need, because I think there is, you know, people have a lot of stereotypes when people say, oh, I've got diabetes, or, you know, you've got type 1 or type 2. I think people always have quite a lot of assumptions. So I guess you can see why some people may be embarrassed when talking about it. But I think it's so incredible that you guys have such an amazing platform and a community base that really does squash all of that. And like you said, speaking about emotions is exactly what you need. And as well as, bringing families involved in it as well, because not everyone is fully educated. So a lot of people, this could be new news to them. So I guess having educators like yourselves really teaching people that, lifestyle changes will make a huge difference. And obviously, as well, if you've got a family member who is diabetic, you need to hold them accountable, like you said, making sure they are taking their medications and keeping them on track with this stuff. So I really, really love that you guys are just there for these people, and it is a very warm and welcoming place for people to go. And of course, it could be very scary as well. Diabetes, it stays with you. So having somebody that you can talk to, I guess, makes such an incredible difference. So thank you so much. And yeah, to reiterate to everyone, there is so many incredible platforms, especially Brent Health. And if you, Diana, if you would love to give those numbers out, that would be great. And then obviously we can go over it again at the end.
Right. Okay. Okay. Do you want me to do that now, or should I wait until later?
We can do it twice if you like.
Yes. Okay. Brent Health Matters Advice Helpline is 0208 102 3456. You have to dial through. When you come to option 2, and then you go to option 4. On option 4, you have all the clinicians that answers. It doesn't go through to receptionist. So you might be speaking to a pharmacist, you might be speaking to a nurse, or you might be speaking to one of the physios or the opticians or a GP as well. Sometimes they're there. So, and it's a very good platform that has been set up by Brent Council, because it's actually helping people, to acknowledge, as you just said, and it's not a taboo. It's not something to be embarrassed about, because it's been here for many years, but we can try to get people, with different research, etc., to manage their diabetes.
Thank you. I think you had something else to say. Go ahead.
So can I also add, as Dr. Katani was saying, when we refer people for the DESMOND program, DESMOND stands for Diabetes Education and Self-Management for Ongoing and Newly Diagnosed Diabetes. It is a one-day program which is covered by the community diabetes, which is CLCH. So the referral pathway. So once you diagnose, the GP sends a referral to CLCH for this DESMOND program. It covers what is diabetes, and for people to understand what diabetes is, how glucose works in the body and the symptoms. It covers monitoring, it covers food and glucose control. That is how carbohydrates containing food affect the blood sugar levels. It discusses all the long-term conditions, problems that you can have relating to diabetes, physical activity, and again, food relating to fats. You develop your own self-management plan. So this is really for anybody diagnosed with diabetes, especially if you're newly diagnosed and you want to self-manage. It's really important that you attend this program. So we have it in Brent, at Willesden Centre for Health and Care, and Wembley Centre for Care, face-to-face. Or for people who can't come face-to-face, we have it online virtually. So people can just tell us what they want and we reach out to them. So that's a snippet about the DESMOND program. As Diane was referred, Daphne is out for type 1, and people go to the hospitals because they have type 1, and that's a different program.
Thank you so much. And I actually wanted to speak to Pravina. Obviously, you have diabetes. I wanted to know how your journey has been, and talk us through your journey when you found out. How was that diagnosis for you?
Oh my God, mine is a very, very weird story, because I must have been a walking, talking diabetic for 5 years, and I was working in Northwick Park Hospital, and I had a boil on my elbow, and I was working in the reception, and it was really getting painful, so I went to A&E, and they looked at my elbow and they said, "Are you diabetic?" And I said, "No." And fine, they just did their job, cleared it out, and I went home. And because I had been to Australia and I had an insect bite everywhere, so maybe that had made it into, that's what my thinking was. And then the following year, I had another boil in the back of my spine, just at the back. And again, the same thing happened. And I feel, oh my God, if I had no education about diabetes, even though my my grandfather, both my fathers were diabetics, and that was the sign. Because when I had my 3 kids, I had the glucose test. They do the test before you have the baby, and I was fine, cleared, and I never had to worry. But I was also very good at exercising and walking, and I was fine. But when I worked in the hospital, I think I was working so hard and never thought about health. And I felt, often I felt tired, I felt thirsty, and I would run to the loo, and my superior would say to me, "Oh, Pravina, you keep going to the toilet so much," but nobody said anything why or what. If only I knew. And then in 2005, I thought I wanted to leave my job, so I retired early at 55. And that was in June. And in July, I went to see the GP because I had been going to the doctors and telling them I'm feeling tired, and they never did anything. But in that January of 2005, I had a blood test. So when I went in July, the nurse said to me, "Oh, Mrs. Vandra, have you got, now let me take a blood test." And I said, "But I've had one in January." So she said, "Let me look at it." And she looked at it and she said, "Oh, you've got diabetes." What a shock it was. I was numb.
Oh, wow.
I just felt really, really bereaved because, with Indians, it's so funny. Diabetes is a big thing. It's like you've committed a sin, you've got diabetes. And somebody in my family had it in 1990s, late. And year 2000, I was told, "Oh, she's only got cholesterol, so she goes on the treadmill." They could not tell the truth. If only she had said something, then I would have also gone and had a test and checked out. And yet I was a volunteer. I used to volunteer with Harrow and Brent for the workshops we did for diabetes. We did it for heart condition, for blood pressures. When I stayed home, I wasn't working. I did this voluntary jobs. But I never looked at myself, did I? And when I got this, and I was really devastated. But never mind. I said, okay. The nurse gave me a diet sheet, and she said, "Look, you could just do that, and then you can still have your meals, but small meals and puddings." And I thought, okay, fine. I was very good at diets and things because I never used to eat chips. I never ate any fried foods. But I think it was sitting and not having enough exercise. And then I also had a stress. In my 40s, I was quite stressed, family problems, whatever it was. Anyway, I carried on. I looked after myself. I lost weight. And then there wasn't anything regular check. It was only once in 6 months I used to go for a blood test. And then it sort of became once in a year because I was doing quite well. But as I was getting older, I think I just didn't realize that this is not right. And it really got me. And I have managed because of people like Diana who have helped us. And then we are also talking to our friends and we're telling, "Come on, get it checked, get it done." And I push everybody. I'm quite open. I don't like to hide my diabetes. As soon as I was told I was diabetic, I told the whole family and I said, "You should all get it checked out." And that's, "No, we're okay." We're okay. Yes, everybody's okay. But then when it catches up, that's it. But yes, I have been very, very good. And my family, my immediate family, my children are very good. They are also watching their diets. They have helped me, supported me. My husband is excellent. He supports me everywhere. And on top of it, my grandson, when he was 5 years old, he said to me, "Daddy," which means grandma, I don't eat sweets, so don't buy any sweets for me.
Oh,
I'm living healthily." So he's 15 now. He's a tall 6-foot kid. amazing. I'm so proud of myself and them because they're all
Oh,
watching. My daughter-in-law has taught me to use cauliflower rice, not basmati rice. So we have cauliflower rice. We between us, and because of me, she has kept herself very straight and narrow. And because of my diabetes, she catches up with me. She says, "How have you been?" And she watches me, which is good. And my medications have reduced, so I'm quite happy. At one time over COVID, I thought that I had won my battle with diabetes. For 5 weeks, I used to check my blood because I did the blood testing and it seemed always very good. But I think I fell again. But yes, I'm happier now. And the stress has gone. So it's keeping me on the straight and narrow. So managing my food, I try and cook everything. My husband doesn't like greens. So what I do is I use potatoes in my okras or in my aubergines or in my karellas. And I'm very clever because you get the juices in there. I don't eat the potatoes. I eat my okras and all my green veggies. And then I just gave him potatoes all the time. Even yesterday, he didn't want my aubergine curry. So I said, okay, I'll make a few potatoes in there and just say you have them. Because he doesn't have diabetes. So he said, why should I? They can get a bit stubborn, but I know how to get around it.
yeah, yeah, yeah.
So it's
Well,
working.
well done. It sounds like you are just dealing with it like an absolute champ. So well done to you. And I think
Like,
it really is like what we have said before. Like you said, you were always, you were always eating relatively well, and you said that maybe it could have been caused because you're eating well, but obviously that exercise portion isn't really there. So it's not always balanced out. And I feel like this is also what we really need to say to people is that you could be super slim and look super fit, but if you don't have that fitness side or
yeah.
one side of it is imbalanced, that is where, these symptoms and this diabetes can come. So, and I love the fact that you really do tell everyone and you just preach it because it is so important and because it can happen to anyone at any age,
Yes.
it is important to make sure people are getting checked. So thank you so much for that.
Oh, you're welcome. I actually I learned to cook and I did courses in cookery, and I was always 3 veg, 1 carb, and 1 meat because I was so literate with it. I knew it all, and I always made sure in my house, in my children's meals, it was always that. But I felt that I did myself no justice because I became fat, working, sitting down, not doing any exercise. And yes, we need to really be on board.
Well, it also seems like obviously, Diana, you've spoken about having the families included. I think we can even see it from your family side that it has been a positive trickle effect. Obviously, having your diagnosis has almost become a bit of a positive ripple in the family where everyone is making these lifestyle changes and is really being implemented in the family, which is so important. And obviously, props to Diana and obviously all of you guys
Yes,
to making
absolutely.
sure that people are educated properly about this. So
Yes.
well done to all of you guys. But I wanted to ask you, how is it managing it every day? Obviously, you said that food changes, and what is your medication like, and how are you kind of controlling that side of the diabetes?
Um, I manage it very well because when I wake up every morning, I have my um, green juice. I have I make concoctions with things like mint, um, coriander. I also put a green chili. I put black pepper and ginger and lemon or limes. And I make a nice big um, container of chutneys and I put it all in little containers. And every morning when I wake up, I have that as my first lining of my stomach with green. And I tell you, it's so, so good because I don't eat. And I've really cut down on my meals because that's what has helped me most. Having too much food. And as we get older, we need smaller portions, but not just that, we need to even cut out. So I do a little bit of that as well. And that is really keeping me very, very strong. And I like it the way I am now. Because I think I did put on weight, not exercising and getting sort of, I was trying to please everybody. I never pleased myself. So now I please myself first. I look after myself. Number one, if you are good, then you will be good for everyone else. And that is so
Exactly.
important.
Quote of the day. Thank you so much.
Thank you.
But fitness wise, obviously I know that you've got your food control is a lot better, and of course you've got your incredible juices, which sound amazing, by the way. How are you maintaining kind of exercising every
Oh,
day?
yes, I'll tell you what I'm doing. I have a yoga class on Monday. I have a yoga class Zoom on Tuesday. Monday I go to a hall, and then on Wednesday I do my yoga. I do my meditation at home. I sit and I'm very, very good at having my own time, and nobody bothers me. So I think to be calm and collective is more important for me. And I also have chair yoga on Thursdays. And then I go for a couple of walks twice a week, or sometimes my husband and I, we go to shows in the city, so we walk a lot. And all that walking is more important. I've got an app on my walking app, so I know how much I'm walking. And I think all that culmination of walking and having my time to myself, yoga and exercising, lots of stretches, lots of rubbing your fingers and doing the yoga moves is very, very important. And also I do in yoga classes, we also do something to do with our chakras, the how you look after your head and ears and your nose and eyes and your mouth, sort of. And I think I'm not very good at explaining, but what I do with them, I'm enjoying it, and I'm really, really learning and teaching now to my children. So it works quite well. And being very, very calm, I am not ever annoyed. And if I do get annoyed, I'd sit down quietly and not show that, because I think we all need to calm down. We all need to be kind to each other, and that kindness also helps me.
Absolutely. Thank you so much. And when we always say exercise and how important exercising is, I think people mistake it by exercises running miles and miles every
No,
day.
no.
There is so many forms
Yeah,
of exercise
yeah,
that can be done that
yeah,
isn't, you know, if you are older, or if you are, firstly getting into fitness, there
yeah,
is so many other things, like you said, yoga, where you're
yeah.
still exercising, you're stretching, but it's still doing your body good.
Yes, I used to do gym because in year 2000 I had a problem with my back. I was working in hospital lifting x-rays, and that was a time I think um, at nearly 40 plus I was not very good with my spine. I think I was sort of lacking in certain things, calcium and vitamin D and so on, but lifting didn't help, and so I had to go to the gym and really work out. And I'm glad that I didn't do too much working out. I'll be honest. I only did about 3/4 of an hour in the gym. I did some walking on the treadmill. I did the legs exercises, and the machines helped me and my lifting myself and my arms and so on. And I think to do something with your limbs is very, very important. Even lying down on the floor and stretching and doing certain moves is amazing, and that's what is helping me, and that's, I think it's good. Yeah.
Amazing. Thank you so much. And
Thank you.
I just wanted to open up the floor to anyone else. Obviously, we've got a couple minutes left of the show. If anyone wanted to reiterate anything we've said previously or at the start, Diana, let's start with you.
Yes. Thank you. I would just like to tell the viewers about No Diabetes, specifically for people who has diabetes in the Northwest London area. And we also do diabetes digital inclusion training for anyone who has diabetes. And we run that for 6 weeks as well. And by so doing, we're able to get people to understand the NHS app, how to do different courses or join different forums on the No Diabetes and with Diabetes UK as well, because it's important that anyone who has diabetes should know about these different service providers that helps them, etc. Not just Brent Health Matters, but outside of Brent, but inside of Brent, No Diabetes is very imperative for anyone who has diabetes because it's got training courses, it's got everything set up for you. And, it's advisable that even if they're pre-diabetic, yes, you are able to understand why you're being pre-diabetic once you stop smoking, drinking alcohol, etc. And when we talk about being active, we have Tai Chi as well involved in our peer support groups. So it's actually giving them a taster of how they can alleviate their stress as well and how they can, relax within their bodies, because not just diabetes, but there's other long-term conditions, as Dr. Katani knows, but I'm not here to talk about that. But by so doing, the Tai Chi is so, so, so imperative.
Oh, I loved it.
Yeah. Thank you so much, Diana. And Dr. Kanati, did you want to add anything onto that as well?
Yes, absolutely. To summarize everything, basically, I would just encourage people to take control of their health, look after themselves, look at exercise is very important, diet, managing stress and sleep is very important. We underestimate the stress and sleep. It is very, very important. And yes, if you do have any doubts, come to us. Many GPs have got online system where they can, even if you're not able to speak to a particular doctor, there's a whole team out there. So GP is not working in isolation. We are working in a combined team where we have nurses, healthcare assistant, dietitian, physiotherapists, pharmacists, all working together. We have access via phone, via online access, which is in many surgeries is called patches or e-consults. So if you have any doubts about diabetes, please reach out. Once if diagnosis is there's a lot of help around. Like Diana said, there are peer support group. Like Anjani said, there is Desmond for education. And No Diabetes, the spelling is KNOW, by the way. It's not no, just to clarify. And it is a very, very helpful platform where there's lots of information. There are lots of recipes and how to manage not only diabetes, but there are other conditions which can be associated like high blood pressure, high cholesterol. So all of those things you can actually get checked on the blood test. And one very important thing I want to say is diabetes also affects your eyes. And the system of checking your eyes is not at the GP surgery, so we cannot check it at the same time. But anybody who's diagnosed with diabetes do get called by retinal screening services. So when they get that invitation, one should go and get their eyes checked, because the changes which happen with diabetes can also lead to blindness. Yeah. And it is preventable, totally preventable, if it is caught and treated early. And many people do not realize that. So please, if you have a diagnosis of diabetes, at least once, or now they have changed for some people who have low risk to once in 2 years to have their eyes checked, because diabetes associated blindness is totally preventable. So that is very, very important to also look out. And once you have diabetes, the GPs invite you for a yearly check in which they check everything, your kidneys, your feet, and your blood pressure, your cholesterol. So all those things need to be checked and controlled. So please attend your annual checks with the GP every year if you have diabetes. Over to Anjali.
Thank you.
Thank you very much. So I'll just reiterate what both Diana and Dr. Katani said is early detection, regular monitoring, lifestyle changes. And if you've been referred for the Desmond Education Program, please attend. It's only 1 day face-to-face or 2 half days online. So that's really important. And you have all the local support groups, networks, No Diabetes. There are lots of information. The whole aim is preventing complications long term. Over to you.
Thank you so much. And you guys were amazing. I mean, I have learned so much just from talking to you. So thank you so much. And Ravina, thank you so much for telling everyone your story and how, how you have dealt with diabetes in such a great way as well. So thank you so much.
Thank you.
Obviously, thank you so much to the Beat listeners for tuning in. We were speaking about diabetes and with the health, Brent Health Matters. So please, if you do have any further questions, please feel free to give us a shout over on the socials of the Beat London, or you can email us as well at info@thebeatlondon1036.com. But thank you so much, you guys. I'm gonna let you all go, but thank you so much for an amazing chat.